but I would absolutely use ADCs in BRCA patients. This is something of an intriguing question, and we have actually looked at our data. Sadly, it didn't show benefit, because the idea is patients with DDR pathway defect would actually respond better to topo-1-based ADCs, right? Because essentially that should predict for better response to any sort of topo-1-based ADCs, not just SASE. That should be true for Dato-DXd as well. So we actually looked at our data internally, but we were not able to show that BRCA status actually predicted better response to patients with these ADCs. So I think, but it still is active. We were hoping to say that they would do better, but they did well, but not the way we expect. So I think it's reasonable to offer ADCs.